Opinion: why is the Republican Party so confused about health care? The New York Times: the GOP needs to finally figure out, or at least start figuring out, exactly what it stands for on health care policy. By Peter Suderman. Mr. Suderman is features editor at Reason. Judging by exit polls, the single most effective midterm issue for Democrats was health care. In particular, the argument, made by Democratic candidates across the country, that Republicans were out to eliminate the Affordable Care Act's regulations governing pre-existing conditions. So when a Texas judge ruled in December that the entirety of the health law was unconstitutional, he ensured that this issue, and this argument, would remain front and center heading into the 2020 election. Legally speaking, the ruling is weak, and the case may be tossed in the appeals process. But if it travels off, the ruling thus represents a challenge for Republicans, but also an opportunity. At least in theory, the empty mantra of repeal and replace which was all but buried by the midterms, was never a stand-in for an actual shared vision for the governance of health care in the United States. At the moment, that confusion extends beyond Obamacare to Medicare, which President Trump has ruled off limits, and Medicaid, which the repeal bills tried and failed to restructure, as well as to the tax deduction for employer-sponsored insurance around which health care policy has contorted for so many decades. It's not that there's a shortage of ideas. Conservative think tanks have health policy white papers to spare, and have for years. All the way back in the Cato Institute's Michael Cannon has long called for the creation of that would dramatically increase the amount of money individuals could put into tax-free accounts for medical expenses, including health insurance, potentially giving millions of people an optional exit from employer-sponsored insurance. What connects these ideas is that they are not merely bullet-pointed lists of policy tweaks. They are frameworks, that sort of thinking about both general principles and the specific policy components necessary to make them a reality. Is exactly what the Republican Party lacks, and what it desperately needs. It's true that some Republican lawmakers have cobbled together proposals of varying degrees of specificity over the year. During his 2016 campaign for the Republican presidential nomination, Senator Marco Rubio of Florida, a mostly forgotten health care plan that would have set up a broad-based system of refundable tax credits intended to subsidize the purchase of insurance in hopes of helping people buy coverage. And during the but these efforts have tended to be cursory and short-lived, with tiny or non-existent constituencies. Few conservative, which is why, for all these ideas, if you ask Republican politicians what they stand for when it comes to health policy, you are likely to hear slogans like patient-centered and preserving the doctor-patient relationship, and possibly something about how Democrats want to socialize Medicare, as if the nation's largest government health program is not already an essentially socialist enterprise. So it's possible to imagine that at least some in the party will try to resolve, or at least start acknowledging, some of these questions. More likely, given the state of the GOP under Trump, who is no one's idea of a wonk, is that Republicans will simply decline to pursue the issue with any force, and the shabbiness of the party's current non-position will become even more glaring. Indeed, just that sort of glibness, in turn, is likely to give already ascendant Democratic ideas a boost. The party's enthusiasm, yet by failing to make even a half-hearted case for an alternative, Republicans are helping to clear the path for their opponents. When the options in the meantime, the Texas case will ensure that the GOP's waffling and uncertainty on policy basics, like legal requirements regarding pre-existing conditions, remain in the spotlight. The Red State Attorney, Peter Suderman, is features editor at Reason. The Times is committed to publishing to the editor. Wednesday. Like to follow the New York Times opinion section on, and
Raindrop, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park, pot.